I'm Jeff, and I work at a homeless shelter. Like you, I work with clients who face many different and difficult challenges. Tuberculosis, otherwise known as TB, is an important issue to be aware of. TB outbreaks have occurred at homeless shelters throughout the United States, primarily because shelters are an ideal setting for this airborne disease. It's a disease often associated with poverty and affected by overcrowded living conditions, poor nutrition, and lack of regular health care. You can create a healthy and safe environment for your clients and coworkers by reassuring them that TB can be prevented, treated, and cured. You don't need to be afraid to work with clients or staff who have TB. By working together, our shelters can do a lot to prevent the spread of TB. In the first part of this presentation, you'll learn about TB and what you and your staff can do when you suspect someone has TB. In the second part of this video, you'll see how shelter managers and the local health department can work together to create an environment that prevents the spread of TB.
Hey, is that the story about the TB outbreak in the homeless shelter back east?
Yeah, it's kind of scary. I wonder if it could happen here at our shelter.
Yeah, I wonder how you get it. Can you get TB from touching a doorknob, or sharing a cigarette, or sharing a beer? Having sex? From a syringe, a mosquito, a bird?
Hey guys, I couldn't help but overhear your conversation. Now, you know you don't get TB from any of those things.
No?
No. And there's no need to freak out about TB as long as you know what it is and what to do about it. Rest assured, you cannot get TB from any of those things you mentioned. It's only one way to get TB. You need to be breathing in the same airspace with someone who has contagious TB. The TB germ is spread by that person's coughs or sneezes.
Sometimes there's a lot of folks coughing around here.
True, but not everyone who's coughing has TB. Usually those who have it have been coughing for a long time. We always ask folks to cover their coughs, and this helps to make sure the germs don't spread. That's why we have posters like this. If you see someone coughing, you should ask them to cover their cough.
I was just sitting next to someone who was coughing. What if they had TB? Could I have gotten it?
Well, say that they have TB. Your chances of catching TB is low if you're around that person for just a short time. You've got to be around them for a while, and they have to be coughing a lot. Now, people who get TB will usually get only an infection.
So you mean I can be around a person with TB and not get sick?
Well, it's highly unlikely that you'll get infected from a one-time encounter. But if you're around a person with TB, your chances of getting infected increase. And infection and disease are different. One way to look at it is, if your immune system is able to fight the TB germs, it can keep the TB germs sleeping. Although you're infected, you stay healthy. Now, on the other hand, if your immune system is compromised by HIV, diabetes, injection drug use, alcohol, or poor nutrition, the TB infection can develop into disease. Now, the important thing to remember is you're more likely to develop disease if you're newly infected because your immune system may not be prepared to fight it yet. That's why it's so important to detect TB early before it turns into disease.
What happens when you get TB disease?
Well, you usually have a cough that won't go away. You may lose weight, have night sweats, a fever, or feel tired. But sometimes there are no symptoms in the early stages. TB can occur in any part of your body, but if the disease is in your lungs, that means you're contagious and you can spread TB to others through coughing. And if you don't get it diagnosed and treated right away, it can lead to death. On the other hand, with TB infection, you don't feel sick. You don't experience any symptoms. You're not contagious, so you cannot spread it to others. You can take medication to prevent disease from ever developing. We're trained to be on the lookout for anyone who's coughing. We have a cough alert policy where we do 3 things. First, we ask you to cover your cough. We offer masks and tissues for you to use. Secondly, we ask you how long you've been coughing. And finally, we take you to see someone to make sure you don't get sick. By doing these things, it keeps our shelter healthy and safe for you, our clients, and staff. This marks the end of the first half of our program. Part of the strategy to prevent the spread of TB is to educate staff about TB. By knowing what TB is, how it spreads, its symptoms, and the difference between infection and disease, we can educate our clients and reduce their fears. You also learned about the cough alert policy for when you suspect someone has TB. You'll see how that policy is implemented in the second part of our video. For more information, please refer to your viewer's guide or your local health department. In this section of the presentation, you'll see how the cough alert policy is implemented when one of our clients is suspected of having TB. You'll also see how shelter staff can work with the health department to prevent the spread of TB. It's important to realize that some shelters are more at risk for TB than others. Because each shelter is set up differently with a variety of client characteristics and needs, each shelter will have its own TB infection control policies based on its resources and risks. Hey, Tom. How you doing, man? What's up?
Not so well.
How long have you had this cough?
2 or 3 weeks. I think it's just a cold. I just can't kick it. This cough isn't getting any better, though.
You want some rest?
I just don't want to bother anybody.
Don't worry about that. I understand. You know, we have an area where you can hang out for a little bit. Okay? And here, why don't you use that to cover your cough? If you need more, you'll find tissue boxes all over the shelter, okay? Hey, Abby.
Hey, Jeff, what's up?
You know, I'm really concerned about Tom. He doesn't look well. He's been coughing 2 to 3 weeks now. I've put him in an area by himself so he can rest.
Good job. Tom can rest, and at the same time, this will help prevent the spread of germs. Do you know if he's been around anyone who's been sick?
Nope.
Do you know who he hangs out with?
Well, you know, he watches TV with Danny and Georgia.
Thanks for letting me know. I'll go talk with Tom. We may need to refer him to the clinic for a full checkup. Hi, Tom. I'm Abby, the manager here. I'm worried about you. How are you feeling?
Not too good. Cough won't go away.
Do you mind if I ask you a few questions to see how we can get you some help?
Help? No. That means doctor. No way. Last time I saw a doctor, she told me I had HIV. I don't want to see no doctor.
I see. Have you been coughing up any phlegm or blood?
No.
Have you lost any weight?
I don't know if I've lost any weight.
How's your appetite?
No, I don't feel like eating.
Yeah. Have you experienced any night sweats or fever?
Yeah, I'm pretty sweaty.
Do you feel tired?
Yeah.
You know, Tom, I'd really like someone from the clinic to take a look at you. A cough that has lasted as long as yours has needs to be seen by a doctor right away. We want you to get better, not worse. Look, the clinic's closed right now, but how about we get you there first thing in the morning?
No, I'm not going to see any doctor. I had a friend once who went and saw a doctor, and when she came back, everybody in the neighborhood knew all her business. I don't want anybody knowing my business.
No one is going to know your business. Anything that you tell me or any staff is kept strictly confidential.
No, I still don't want to go.
Okay. Why don't you stay here and get some more rest, and I'll check in with you later to see how you're doing. I brought you a mask and some tissue.
What's this for?
To help cover your cough.
You want me to wear that? No, I'm not wearing that. Everybody's gonna think I got something.
It helps prevent the spread of germs. Look, if you're uncomfortable wearing the mask, then please continue to use a tissue to cover your cough. I'll leave the mask here just in case you change your mind. Okay. I'm having a little problem with one of my clients. His name is Tom. I'm trying to get him into the clinic to be seen for a full checkup.
Concerned about Tom's reluctance to get medical care and suspicious that he might have TB, Abby calls her local TB clinic contact, Steve, for assistance. Steve comes to the shelter to talk with Tom. Steve convinces Tom to go to the clinic by giving him caring advice and a little incentive. Tom also realizes he can affect everyone around him, so he agrees to go get a full checkup.
Hello?
Hi, Abby. It's Steve from the TB clinic.
Hey, Steve. Any word on Tom?
Tom's workup came back positive for TB disease, but he's going to be okay.
I'm so glad you were able to get him to the clinic. What's happening now?
Well, we've started him on medication, and we're going to continue to care for him in another housing facility until the TB program says he's no longer contagious. At that point, Tom can return to your shelter.
That's good.
Yeah. Oh, and one more thing. We need to make sure that no one else at your shelter is infected, and we'd like your staff's cooperation, so can we come and screen your clients tomorrow?
Sure, no problem.
Thanks. See you tomorrow. Oh, and remember, Tom's identity is confidential, right? We have got to protect his privacy.
Okay.
Bye.
Bye.
Steve's here at the shelter to test everyone to determine if anyone's been infected with TB. I'm going to get in line. After the testing, Steve meets with Abby to review the shelter's records for Tom's attendance and notes other elements in the shelter that can prevent the spread of TB.
Wow, you keep really good records. So, the next step is to do a contact investigation where we try to find out who socializes with Tom to see if they've been infected. Tom has been very reluctant to pass along any names. Do you know anyone?
Well, actually, one of our staff members did see a few clients hang out with Tom. Here are their names. And here's a log of bed numbers to see who slept in areas near Tom.
Good. This will help us. Say, does your shelter have a TB infection control policy?
Yeah, we do. It begins with training our staff about TB. They know to alert me or one of the on-site healthcare workers if they notice someone who's been coughing for a while. If one of the healthcare workers is not on site, I make a referral for the care. And if TB is suspect, I contact the health department. We conduct regularly scheduled TB screenings for all our clients, staff, and volunteers every 6 to 12 months. We're trying to prevent TB outbreaks like the ones I've heard are happening in shelters throughout the country.
Well, some shelters require mandatory screening for clients and some don't. Check with your local health department and the local TB policy because it's different everywhere. But mandatory screenings do help prevent outbreaks. And clients get a TB clearance card that looks like this. And all they have to do is just show that to staff when registering for a bed.
Let me show you what other things we're doing to prevent the spread of TB.
Oh, okay.
We always have a supply of surgical masks to give to people to cover their coughs. There's only one problem. People don't like wearing them. They feel like they're being singled out and something's wrong. Although we encourage the use of the mask, we also find that a gentle reminder about covering their coughs and providing them with tissue can work too.
Well, all this makes for a healthy and safe shelter because people don't want to get other people sick.
We don't really have enough resources to install the HEPA filters and the ultraviolet lights that the health department recommends. So we do our best to keep the fans on and the windows open to ventilate the space. We know that TB can spread easily in overcrowded living conditions like our shelter. People sometimes complain that it's too cold, but when we explain that we need to keep the fresh air moving in order to prevent the spread of disease, they're okay with the cold air.
Well, I completely understand about limited resources. Fans and open windows definitely help. Lots of fresh air and sunlight will help kill germs.
But we also try to keep our mats far apart. And if possible, use a head-to-foot arrangement instead of a head-to-head. However, the head-to-foot arrangement doesn't always work. Folks don't like sleeping too close to other people's feet. So we try to place the mats at least 3 to 4 feet apart.
Looks like you are well prepared.
2 days later, Steve returns to the shelter to check on everyone's TB tests. He finds that Danny, a shelter client who watched TV regularly with Tom, has a positive skin test, and that means TB infection. This infection can turn into disease, making Danny very sick. Fortunately, Danny's immune system is fighting it off for the moment, and he feels fine. However, because he is newly infected, Danny starts treatment with a medicine called INH for 6 to 9 months. So let's see how Tom is doing with his case of TB disease. Someone from the clinic delivers Tom's medicine daily to him for 6 months. This is called Directly Observed Therapy, or DOT, which allows clinic staff to see how Tom is doing. It's really important that he takes all of his medication. If he doesn't, some of the TB germs may survive and turn into what's called drug-resistant TB, which is much harder to treat. The good news is Tom is getting better every day. So, there you have it. You saw how implementing a cough alert policy started a series of actions where both the shelter and the local health department work together to prevent and control the spread of TB. This cooperation and communication is crucial for success. As we walked through the shelter, you saw how the shelter's TB policy provided education for staff and clients. You learned about what to do when staff suspects someone has TB. You saw cover your cough posters posted on the walls. You saw the use of masks, tissues, fans, windows, and bed placement. By doing all of these things, you can help prevent the spread of TB. For more information, additional resources can be found in your viewer's guide. And remember, to create a healthy shelter environment for your clients and staff, be prepared and know about TB. Good luck keeping your shelter healthy and safe.